Welcome to the ASRS Oral History of Retina series. The purpose of these interviews is to capture first-hand stories from individuals with unique retinal insights of historical significance.
Through these discussions, we will fill in gaps in our understanding of the evolution of the science and practice of retina. And it's our hope that these discussions will serve as the illuminating element in the larger mosaic of the history of retina.
I am delighted to have with me today Dr. Don D'Amico. Don is professor and chairman of ophthalmology at Weill Cornell Medical College of Cornell University in New York, a position that he has held since 2006. Prior to that, Don spent 24 years at Harvard Medical School, starting there in 1982, following his retina fellowship at Bascom Palmer in Miami. His career is a clear reflection of his passion and skill for teaching and the desire of others to have him assume leadership roles in numerous important retina organizations. Don served as president of Club Jules Gonan from 2009 to 2012. He served as president of the Retina Society from 2007 to 2009, and he has served as program chair of the Aspen Retina Detachment Society since 2000. And more recently, Don has served as the first editor-in-chief of the ASRS Journal of Vitreoretinal Diseases since its inception in 2017. Don's delivered innumerable lectures and courses nationally and internationally. He has published over 160 papers and over 60 book chapters and reviews. So it should come as no surprise that Don has a long list of honors and awards and other forms of recognition that he has received during the course of his illustrious career. The retina community's appreciation of Don's academic contributions is matched only by a similar admiration of his engaging wit, charm, and storytelling abilities. Don, thanks so much for joining me here today.
It's a pleasure to be here, John.
Inquiring minds want to know, what was life like as little Don D'Amico? Growing up in Chicago, I think you grew up in a neighborhood near the Loop, is that right?
That's right. I'm a very proud Chicagoan, and I grew up just outside the Loop near the old Montgomery Ward's building, if you know where that is. It's no longer there. And I grew up in a very Italian-American family, kind of an I Remember Mama style family with ethnic food and lots of cousins and lots of relatives and stuff. And then my family moved a little further out west to the Division and Pulaski area, which was also a very Italian neighborhood.
What was school like for you growing up?
A couple of interesting things in my grammar school experience. I was in the Our Lady of the Angels Fire, which was a big event in Chicago, December 1, 1958. Some 92 children were killed and 3 teachers, and I was in that fire, and it just changed the whole neighborhood. And there were no grief counselors or, any kind of reporting. It was a neglected event for a long time. And I had a chance a number of years ago to go to the 50th anniversary celebration of that fire and its victims. My dad died when I was 11, and I wound up in a variety of jobs. We all had to go to work to try to support the family. So my first job was really to be a busboy. And my mom was a waitress, and I could run through a dining room with 2 filled water glass trays, held one on each shoulder and all, and it was great fun. And I was a printer and did other things. But probably the one thing I would really help me that I didn't expect was in 8th grade when we graduated, and we were all ready to go out and play baseball for the summer. My mom told me, "Oh, guess what? I've signed you up for a course in public speaking." I'm like, what? Well, it turned out there was a nun. I went to a Catholic grammar school, Sister Act 2 kind of nun, I guess, who decided she was going to take a group of about a dozen of us and teach us public speaking. And so I wound up for 5 hours a day for like 3 weeks in the summer with her in a classroom. "Donald, you're moving your hands. Donald, I want you to make eye contact with every person. Donald, you should have taken a breath." I owe that woman so much. I wish I could remember her name, but I mean, who would have thought I would use those skills in my professional career and really throughout my life?
And it's remarkable your mom had the thought to even sign you up for that.
She was a remarkable woman. Without question, the hardest working person that anyone who knew her knew. I mean, the first comment out of their mouth is, Josie D'Amico, wow, what a worker. And, you know, she had the support of a strong family, but no financial resources. And we were three boys. I was the unfortunate middle boy. And my older brother's a dentist. I became a doctor, and my younger brother's an attorney. So I'm really here, John, coasting on my mother's energy. And I hope I can continue to coast for a long time.
And did you have a career goal during high school? Did you have any idea of what you wanted to do?
Yeah, I was headed for being a chemist. And when it came time for college applications, somebody said, you ought to really look at MIT. And I said, well, wait a minute, okay, sure, hadn't really traveled. And so my mom said, well, we can try an application to MIT, and if they're able to give you a scholarship, you can go. But if not, we have IIT here in Chicago, which is also very good. So I sent in an application, and this man from another world appeared in the west side of Chicago at our home, and he talked to me for about an hour. I don't remember what we talked about, but he looked at me and he said, I really think you should go to MIT. And it was just as though he took me from one world, and I got in early admissions, as I recall, and I went, and that was also transformative. But such a lucky break. And again, another person whose name I cannot remember, I really wish I could remember him, because he saw something in my dreams and what I wanted to do. But I was very much headed to a career in chemistry.
Something got derailed. You're off to MIT, you're planning a career in chemistry, but something happened.
Well, find someone for me for whom something doesn't happen during college, right? I was there during a very interesting period. I was a hippie. I was a very ardent chemistry student. I was on the fencing team. I fenced epee. I was also involved in theater and drama, again, as a director. But as a junior, I was set to go to chemistry, and I had no idea what a chemical career would look like. So I was actually microwaving a hamburger in the basement of Building 10, and one of the grad students, who was a TA, came up to me, and he was, a supervisor, and he said, so Don, what polymer are you going to work on when you graduate? I was completely stunned when he asked me what polymer I was going to work on. I said, what are you talking about? He says, well, where do you think the jobs are? Paints and polymers. And, I couldn't believe it. Suddenly the entire ideal world of chemistry, everything is perfect, PV equals nRT, ideal gas law, mixing matter to make new things. It was suddenly shrunk down to a career where, I don't know, I'd be making laundry baskets that don't crack or something like that. And so I literally ran from that microwave burger, the ones that puff up they're horrible. I'm sure I'm going to pay the consequences. And I ran to my advisor, and as I'm running down the hall or walking quickly, on the pillar, one of the pillars in the great corridor, was an MCAT test announcement for this weekend. And so I asked my advisor if there was any chance. I just told him I had to do something with people. I could not simply do paints and polymers. And he arranged to get me a copy of the test. But I had absolutely never thought of a medical career prior to that moment, which is, a lot of people have a black bag when they're 5. I was somebody who just had never thought of the future. I was just so happy doing chemistry, and medicine found me.
So then you're off to University of Illinois. You went to med school there from 72 to 77. What was that experience like?
I arrived in Chicago in 1972, and I was a complete misfit in every way. Like, there were no long hairs in Chicago at the time, and everyone was saying, well, you're going to cut your hair, aren't you? And I wound up, U of I was very good to me, but it is an enormous medical school. I mean, you're talking about 130, maybe more people in a lecture hall. And I realized I couldn't do it. I was accepted into an independent study option called the James Scholar Program, which meant I was free to go anywhere in the country while I was a U of I medical student. But when I got into that lecture hall and saw what was being offered as biochemistry, I had a biochemistry degree, and I said, I'm not going to do this. So I left medical school. I literally left, and I found a research position at Michael Reese Hospital with an amazing physician named Harold Klawans. He was a polymath. I mean, he was a legend in Chicago. He was an expert on baseball. He was a gifted neurologist. And so I wound up in his lab working on extrapyramidal diseases, feeding rats amphetamines and inducing Parkinson's disease models and tardive dyskinesias and all. And I did that for a year. And finally, a woman was absolutely dear to me, Marilyn Miller, super famous ophthalmologist and my advisor, she called me up and she said, are you coming back, Don? Are you? And I said, well, I don't really know. I was rounding with the neurologists, but as a lab person in a white coat. So Marilyn said, well, we have this guy in Chicago, Mickey Rosenberg. He's a neuro-ophthalmologist. Maybe you'd like to visit with him. So I said, okay, great, sure. So I spent 2 weeks with Mickey, who was really a wonderful guy and very, very kind to me and very insightful. He said, you like this neurology stuff. You ought to see if we can get you a spot with the man who trained me, Bill Hoyt, in San Francisco. There I am, Bill Hoyt, just an absolutely dear figure to me too. He accepted me for 3 months in 1975. So I go out to San Francisco. I'm living in a dorm in a tiny room, and here's this towering and at the time ferocious figure who never talked to medical students and could keep 4 of the brightest neurosurgical, neurologic, ophthalmologic fellows going at once, and had this unbelievable practice style where the most complicated patients in the world. And I was like this person tagging along on this team. By the way, Jorge Alvarado of the EM book was also on the service at the same time. And one day, he and Larry Stark, who was an optometrist, they were doing eye movement recordings. And they had a patient who had Sylvian aqueduct syndrome, who had convergence retraction nystagmus. And they said on a Friday, Don, take this recording home, and on Monday, tell us something about it that we don't know. Well, what do I know about eye movement recordings? So I go down to Stanford on the peninsula to my friends, and we're all looking at it, and we're measuring it with rulers and slopes. And John, it turns out that the convergence retraction nystagmus is actually happening at saccadic velocity. So it's a Haring law violation. And I went in on Monday and we talked about it. And 2 things happened. For the rest of the 3 months, Dr. Hoyt would always say, now, Don, are you able to see these? He'd pull me out of his aircraft carrier and grand rounds. Now, Don, what do you think of the pupil here? And Don, it's just like a dream come true. And we also published it. So if you look at my CV, one of my earliest publications is in Brain with Bill Hoyt on convergence. But, at the end of his experience, he looks at me and says, Don, you ought to be a neurosurgeon. I looked at him, a neurosurgeon. And he said, well, if you don't want to be a neurosurgeon, you should certainly be a neurologist. And I'm thinking, God, I'm not sure I want to be a neurologist. He said, well, failing that, you could really make the choice that I did. It was really not the greatest choice. You could become, an ophthalmologist. And I looked at him and I said, Dr. Hoyt, I really think I'd like to be an ophthalmologist. I'd really like to see what that's all about. And he was instrumental in helping me with my applications and wrote me letters that instantly got me interviews all around. I mean, it was so transformational.
So then you went on to Mass Ioneer for your residency?
Yeah, Mass Ioneer was great. I loved Boston. And when I met Klaus Dolman in the just completed Mass Ioneer Infirmary, we were sitting in a shell space, so the 11th or whatever floor was still not fleshed out, and the columns were all coated with this crumbly white stuff. And he's sitting at a table that's probably 2 feet by 1 feet with a chair on either end and his pad with his famous pencil. And he looks up at me, and then he looks at the column, and his first 3 words to me were, "It's not asbestos." So I always tease him about that. But I loved the infirmary. He said, "Listen, you can do neuro-op here, you can do retina here, you can do cornea. We have a full program. You can do your research here. You can do whatever."
And you did your retina fellowship down at Bascom Palmer from 1981 to 1982?
Yeah, at the time it was a 1-year fellowship, and I was really torn between the Milwaukee Fellowship and the Bascom Palmer Fellowship. And I found myself drawn to Bascom Palmer by 2 things. Number one, the size of the institution. I seem to do better with, maybe I need them. I know I need them. A lot of people around and a lot of possibilities. But the people, I mean, Ed Norton and Vic Curtin, both of whom I remained very close to throughout my career. I'll share one moment with Vic Curtin in the operating room. So I had trained in the Schepens tradition, you know, you're dissecting sclera, you're looking at sclera, you're diathermizing sclera, you're exposing sclera. And I went into the OR, and there's Vic Curtin with the headpiece on, and the fellow is holding the thing. I'm the visiting fellow applicant, and he's cryoing the retinal break. And he was a tall guy, but the feeling of total control and mastery that he had over the retina in the moment, I just looked at that and said, that's what I want to be. That's what I want to be. And so emotionally, I just couldn't turn Bascom Palmer down, and it proved to be the right choice for me.
So just to set the stage, Robert Mockimer had left a few years earlier, right? Very early stages of development of vitrectomy, the VISC. What were they using at Bascom Palmer after he left? Were they using the VISC, the Icotome, a combination?
With the use of the VISC, I remember that George would always pop he was a master diabetic vitrectomist, and he would take and grab the proliferation in diabetics right at the disc and just pull it. And, you know, now when I see people saying, well, you can usually find some separation at the disc, he was fearless. He would just pull that thing right off.
So George Blankenship was using the VISC, but were the majority of people using the Icotome?
Yes. Typical cases would be vitreous hemorrhage, diabetic traction detachment, macular pucker surgery. Yes, we did macular puckers. We argued over whether you should use a pick or a bent needle. The concept of doing the pucker directly with the forceps, so-called pinch peeling, would be later introduced by Steve Charles. PVR surgery was just coming in. There was no retinotomy. So PVR surgery was this terrifying mix between peeling and not trying to make retinal breaks. Because remember, the endo laser was not introduced until 1984, right? So 81.
And you didn't have fluid air exchange.
No. So you had this terrible instrument called endocryo, which could create hemorrhage if you moved during the freeze. For a while in the subsequent years, we tried to use xenon with an endocoagulator by putting a little helon to keep the thing from burning up because the fiber would burn up. But we didn't have any way really to treat a posterior break. So posterior break, people would talk about, hey, I did, 3 months of diabetic surgery and I didn't make a posterior break. Now that's completely flipped. the whole goal is to relieve all the traction and, get everything off the retina, and breaks if you need them. If they're part of the consequences, that's fine, you deal with them. But that was the surgery.
So what led to your first job at Mass Eye and Ear? You were there from 1982 to 2006. So what made you decide on Mass Eye and Ear?
Yeah, so there were vague comments about me possibly coming back to the infirmary after my fellowship. And those comments remain vague for a long time. I'm there, it's, the fellowship is going along, and I'm having a great time and learning a ton. And it's like, is there a job or what? So meanwhile, I was really interested in research, and I wanted to study the toxic effects of intravitreal antibiotics. Harry Flynn was very involved in endophthalmitis, and I had ideas that I might look some more at drug effects in the eye. So I wrote a grant, and I wound up with an R23, I think it was called, grant, which had substantial funding. And there was still no word from the infirmary. And so finally I called up Charlie Regan, who was the head of the retina service. I said, do you guys want me back or what? He said, oh yeah, we want you back, we want you back. So they ultimately were very gracious and offered me a job. So I wound up in Klaus Dolman's office again, and he looked at me and he said, wow, your grant gives you $40,000 a year salary support and additional research support. You have personal support of $40,000. So let's make your salary $45,000. And I was regarded as the chief resident that year, but because I was retina trained, I wound up doing 180 some retina cases. So for that $5,000, I think I paid my way. Actually, of course, if you look at the deal, I got the better part of the deal. Who gets to do 180 cases of every imaginable complexity as a young attending? And so, I worked with Evan Gregutis and Charlie Regan on the retina service, and really a phenomenal experience for me, and quickly became very surgically active in the retina service.
When you left fellowship, did you feel like you were prepared to manage any retinal detachment or any retinal complexity that you saw, or did you feel like you still needed some help sometimes from your mentors that trained you?
Well, I think when we leave fellowship, we would be abnormal if we didn't feel like we needed help from our mentors. But I have to say, the experience of fellowship for me was really enabling. I would do 5 buckles with Don Gass in a morning, in a day, and he would teach you all his tricks, and 5 buckles a day, and then the next day you'd be in clinic, then the next day you'd do 4 vitrectomies. I mean, this was, and pieces were still being put in place in the basic understanding of vitrectomy. So when I arrived at Mass Eye and Ear, this is going to sound pretentious, but I was really well trained. When they got to looking at who could do certain procedures, Charlie Regan said, Don, can you handle the diabetic clinic? I said, yeah, I've been trained to do traction detachments. Then he said, well, what about giant tears? There were only 2, if you count Schepens, 3 people at the infirmary who were able to do giant tears. One was, of course, Hal Freeman. The second was Tatsuo Hiroshi, magnificent surgeon. And the third, of course, was Dr. Schepens himself. And I said, well, I can do giant tears. I've been trained to do them. I understand the principles of giant tear surgery. So that was kind of wild, because they initially wanted to say, well, we're not really sure. Maybe you should refer those cases away. And I said, no, I'll do them. Now, if you remember, I don't know if you've seen the original Freeman table. I believe it's now in the Smithsonian. The Stryker table that was invented later is much more sensible. It rotates around your body axis. The Schepens table rotates, there's a pivot at your waist, and it rotates like that. The procedure was to take about 1 million Kerlicks and belts and just strap the patient in, and belting, and the patient's under general. So anesthesia would only give you maximum, I think it was 15 to 20 minutes upside down. And my first patient was like 6'3" and 230 pounds. I forget the nurse's name, but she would just curlex and say, no, we need more. And the head was like a mummy. And we had to go in this particular guy head down first. So we're doing that. And you finally arrive with the patient upside down, and then that collar, that joint could elevate the table up to the sky. So you were under the patient who's on, anesthesia's freaking out and you're freaking out. If you look at one of Steve Charles' books, he shows himself on a dolly under the bed. He's got safety goggles on because there's all kinds of stuff falling and dripping, and I don't think it would fly.
Yeah, so all the fluid contents have to go somewhere.
Yeah.
And they end up
They
on
go
your face
somewhere.
and yeah.
But, conceptually, what a brilliant idea. So the goal was to have the retinal flower, so to speak, hanging down from the disc, either, whole or in part. And then you would be looking up with the indirect on and trying to find the attached part of the retina, or at least to get access to the disc surface. The way we did it, if you had, say, a 180, is you put the cannula for the vitrectomy in the center of the part that was still attached to the pars plana. And then when you were upside down, you knew that the bubble would come in and run across the attached retina and ultimately balloon out the detached retina. And then, you were there and you'd try to bring all the fluid down to the back of the cornea. These patients were always aphakic. Back of the cornea, and keep draining and keep pumping until you had it. And then you'd put the patient back over.
It's what I love about innovation, right? Up until then, everybody would say, well, there's nothing that you can do, until somebody says, well, no, I'll turn the table upside down. We'll figure out a way to turn this table upside down and operate, do this procedure upside down. That's just incredible. It takes one individual that says, no, there's a way to do this.
There was a wild man at MIT in that period who was trying to find a way with ball bearings and a magnetic thing to drop them on the disc and then pull the ball bearings up to the side. So, there's all kinds of innovation in the history of giant tear repair.
So how do you recover from a bad experience in the OR? What enables you to keep going, don't let it get you down in terms of pulling back from, the types of cases that you're willing to do? Because if you start pulling back, you can't move forward, right?
Right. Well, I think the first thing is to realize that it's not about me. It's not about how I feel and all in the end. It's about there's a patient who's suffering, who needs something, and there'll be another patient who's suffering, who will need a surgeon who is able and willing to take up the case and to try and to come back. So really it's a question of understanding what purpose I'm serving, not what I'm doing, what I'm serving. And so that's one, a big one. The second is understanding that I'm operating on a patient who needs the surgery. So if you're iffy about going into an OR, can I wait, can I go? Don't go to the OR. But man, if you're there and the case is unbelievably tough and it's the 11th hour for this eye and this person's vision, and you're taking up the battle, and you've done your preparation, you've learned about the instruments, you've talked to colleagues, you've gone to meetings, you've done everything you can possibly do to refine yourself as an instrument, then I think you can find the courage to move forward.
Well, and certainly your wizardry in the operating room, your extensive research, your oration, your ability to teach others has led to a large number of honors and awards that you've accumulated over the years. And I know they're all very valuable and important to you, but are there a couple in particular that stand out as particularly satisfying?
You're very kind, and I would say of awards and honors, I would mention two. One is the Pyrrhon Award of the ASRS. I can remember when George Williams called me and said, Don, we would like you to receive our Pyrrhon Award. I was like stunned. And I said, well, George, and he said, Don, you've trained so many retina fellows so attentively, something like that. And I was choked up because it's why I do my job, is the training. It was really a great honor for me, and I'm very thankful to the ASRS. The second thing that I would mention is kind of strange maybe, but later in life, international ophthalmology was always very important to me. I'm probably sort of known as a Europhile. I decided after partial experience with a zillion languages, in high school and elsewhere, that I was really going to learn one. And I threw myself at the age of 49 into Italian. And I started with fellows and courses and CDs in every imaginable way. And I speak Italian now, and I'm very active in Italian and European ophthalmology. I think the only reason I was able to be president of Gonin is that I spoke one of their languages. But it's opened a whole new world for me. I have close relations to colleagues all over the world. I travel with them in their meetings and societies. It's opened up something that I didn't expect by, staring at the subjunctive and declined verbs and all of that. And they have taken me in and given me award lectures and things like that. And I treasure them highly because it's something that we share. And it's given me back a part of my culture as growing up in an Italian neighborhood in Chicago. I now can see even more deeply.
Final question. What value do you hope will be derived from this interview 50, 100 years from now?
I would just want the viewer to know that at this point in time, a group of specialists, of individuals, worked really hard at improving retinal care, that we did our best to carry the ball, that we did it collaboratively, and that we also had a lot of fun while doing it. That's what I'd want them to remember.
Don, thanks so much for spending this time with me.
Thank you, John. It's been a pleasure.